What if the blood pressure number you've been chasing for years is actually putting your life at risk? What if perfect blood pressure isn't perfect at all, especially if you're over 65? New research published just weeks ago suggests that lowering blood pressure too much in seniors may increase the risk of falls, brain injury, kidney damage, and even death. And most people, patients and doctors alike, don't know this yet. Welcome to my YouTube channel. I'm Dr. Robert. After more than 20 years working with heart and aging patients, I can tell you this: blood pressure targets are not one size fits all. Today I am going to explain why the traditional goal of 120/80 may be unsafe for older adults, what the latest research actually shows, and how to find the right blood pressure range for your age and health without putting yourself at risk. But I'm not going to give you the ideal number just yet, because if you jump straight to the number without understanding why, you could make a dangerous mistake. First, you need to understand what really happens when blood pressure goes too low in seniors. A real-life story that changes everything. Let me tell you about a woman I'll call Margaret. Margaret was 79 years old, independent, active, living on her own. Her blood pressure had been mildly high for years, around 150/85. Her doctor wanted it lower, much lower. Medication was increased. Then another drug was added. Eventually, her readings reached what everyone called perfect, 121/77. On paper, it looked great, but Margaret began feeling off. Every time she stood up, she felt lightheaded. Sometimes the room spun. She started moving slowly, carefully, afraid of falling. She mentioned it at appointments. She was told it was just aging. Then one morning, she stood up too quickly. She collapsed. That fall fractured her hip, and her life was never the same. Within months, complications followed: loss of mobility, repeated hospital stays, and eventually, a condition her body couldn't recover from. The cause wasn't weak bones, it wasn't bad luck, it was blood pressure. That was too low for her age, while lower is not always better after 65. Here's what most people don't realize. As we age, the body changes in ways that require slightly higher blood pressure to function safely. Stiffer arteries. Older arteries don't expand the way younger ones do. That means the brain needs more pressure, not less, to get enough blood, especially when standing. Slower pressure. Sensors. Your body uses special sensors to adjust blood pressure when you move. With age, those sensors react more slowly. If pressure is already low, standing up can cause a sudden drop, leading to dizziness or blackouts. Medication sensitivity. Kidneys and liver slow down with age. Blood pressure drugs stay in the body longer and hit harder. A dose that's safe at 50 may be dangerous at 80. For different risks, younger adults face long-term damage from high blood pressure. Older adults face immediate danger from low blood pressure, falls, fractures, brain injury. A fall at 80 can be fatal within months. That changes everything. The new research actually shows. A major study published recently in a leading medical journal followed over 15,000 adults aged 75 and older. Unlike older studies, this one included real-world seniors. Frailty, diabetes, prior strokes, kidney disease. Here's what they found. Below 120 systolic, higher risk of falls, kidney injury, fainting, and death. Above 150 systolic, higher risk of stroke and heart attack. The safest range. 132/140 systolic. That range was linked to better survival, fewer falls, better brain and kidney function. This shocked many researchers, but it makes sense when you understand aging physiology. The brain and kidneys need pressure. Blood has to fight gravity to reach your brain. In seniors, pressure that's too low means dizziness, confusion, fatigue, memory problems. Over time, reduced blood flow may even contribute to cognitive decline. The kidneys suffer too. Low pressure means poor filtration, sometimes leading to sudden kidney injury. So yes, blood pressure can be too low. So what should your target be? Now we can talk numbers, but remember, these are guidelines, not rules. Ages 65-75 healthy, active 130-140-70-85. Ages 75-85 135-145-70-85. Over 85 or frail 140-150-70-85 with diabetes, heart disease, or kidney disease. Often 130-140, closely monitored. What matters more than the exact number is how you feel and whether your pressure drops when you stand. The most important test no one does, it's called orthostatic blood pressure testing. Here's how. Lie down for 5 minutes, check BP, stand up, check BP again. If top number drops 20 plus points or bottom number drops 10 plus points, that's dangerous no matter how good your resting number looks. This test could prevent a fall, a fracture, or worse. What you should do next: track blood pressure at home, check standing versus lying readings, pay attention to dizziness or fatigue. Discuss age-appropriate targets with your doctor, never change medication on your own, remember, treat the person, not the number. Final takeaway: 120/80 is not magic, it's not universal, and for many older adults it may be harmful. The safest blood pressure is the one that keeps you steady on your feet, keeps blood flowing to your brain, preserves independence and quality of life. If this video helped you understand your blood pressure in a new way, don't stop here. Watch the next video on your screen to learn early warning signs your blood pressure may be too low. Subscribe to this channel for honest, up-to-date health insights that empower you to take control of your health before problems start. Thank you for watching. I'll see you in the next video.